Exterior view of the Children's Hospital of San Antonio showing the Spirit of Healing mural. Stephanie Salinas, Montefiore HPOG participant, cooks while her young daughter plays with a bottle in the foreground.
I'm Stephanie Salinas. I have two beautiful daughters, Celine Catherine and Arabella Ray. And I'm an HPOG graduate.
Text appears on screen. Trials to Triumph, Stephanie's story.
I know when I graduated high school that I wanted to go to school. That right there was a big motivation because it meant that I was going to be the first in my family to graduate college.
Stephanie walks downstairs holding her daughter.
And then having my kids I felt like it took away going to school because I thought it would just be way too much, it'd be overwhelming. And then I started to struggle. I didn't have money, I didn't have a car. It's just hard to stay at home by myself. Like, I couldn't afford my rent. I had to find transportation to take them to their appointments. And I knew that I didn't want that life for them.
View of the horizon. A field of wildflowers moves in the breeze around a single tree.
My grandmother was the one who introduced me to HPOG.
Te dije yo, just try it, mija, and see, what will they help you, en qué te podían ayudar.
Spanish to English translation appears on screen. I told you, just try it, mija. What could they help you with? Alamo Colleges students gather in a cafeteria to eat lunch. Esther Metcalf, Grant Project Director of the Alamo Colleges Health Professions Opportunity Grant, sits in her office.
So the typical student in this community, when you get to know them, you meet them, when they come to the information sessions, they're ready for change. They want a change.
Alamo Colleges is one of 32 HPOG programs across the country. Nick Alvarado, HPOG Senior Advisor Job Placement Program, is interviewed in the cafeteria.
So from the very beginning, when she comes to the info session, she's dealing with our case management team. And so they're there every step of the way through their curriculum.
So we provide emergency assistance, housing assistance. We even provide childcare assistance. That is tremendous for some of our students.
Students work in a computer lab.
We do as much as we can to make sure that they can focus on going to school and passing their exams.
One of the services that we provide is job development. So we set up externship for our students. They have to do 120 hours in their career field at one of the facilities in the community. And we partner with employers in this community.
HPOG programs give individuals the opportunity to obtain training and support services resulting in healthcare employment.
Everything that we learned in class, they said you may or may not do it, in your externship, but there's some things that you need to know. The externship that I did attend, every single clinical, every single skill that we learned, I did at the externship.
She did her externship in a long-term care facility. She performed well. She had a job there waiting for her if she had wanted it.
It was nice, but I wanted more. I wanted to do something more.
And she had her mind set on what she wanted to do, and she wanted to be in the hospital system.
Nurses walk under the entrance sign to the Children's Hospital of San Antonio, Christus Health.
I completed the CNA program and I wanted to help people, but that wasn't the right path for me. So I looked everywhere. I put in like 15, 20 applications everywhere. And I got accepted to Christus Santa Rosa Hospital as a surgical attendant.
Stephanie walks through the doors of the sterile processing department. Jesse Zambrano, Stephanie's SPD supervisor at Christus Santa Rosa Medical Center, stands in a hospital room.
Steph was hired as a patient transporter. When she wasn't transporting patients, she would come to the back and volunteer to help us put trays together and peel pack and stuff like that. So that caught my eye right away.
And a month into me being hired, I was already asked if I wanted the promotion.
We brought her on days for maybe 6 months. She was a quick learner, so she didn't have to stay on days too long. She was quickly moved to 311 because she got on so quickly.
I don't see myself being a quitter anymore. I don't see myself failing anymore. I finished one thing. I finished a chapter and I'm ready to open up a new chapter to another degree, another higher paying career.
She did so well, her impact with us, that we chose her to be the speaker at her graduation. She did phenomenal. She didn't leave a dry eye in the auditorium, and it makes me a little emotional because she's just one of all the students that got to graduate, and she got to tell and share her story.
HPOG participants are building pathways to a brighter future. HPOG, Health Profession Opportunity Grants Office of Family Assistance logo. This video was supported by contract number GS-07F0495Y, order number HHS P2332015003778G to Burnett Garcia Advertising from the Administration for Children and Families, U.S. Department of Health and Human Services.